I'm Karen Wood. I'm a pathologist and CEO here at Aotea Pathology.
I'm Keiry Belton. I'm the General Manager here at Aotea Pathology.
Aotea Pathology has had a relationship with HealthLink for many, many years. They have been responsible for carrying the data that travels between the medical laboratory and the practices when we send out laboratory results. That's one leg of the reporting cycle. The next is automating the incoming data, and I think both HealthLink and ourselves have seen that as the obvious next step in the process.
The orders, which comprise a specimen and a request form, come in from the community practices through our courier system and arrive at the main laboratories or the hub laboratory receptions. And we check the matching specimen and form, and then all the data relating to that patient request, the patient demographic data and the request information needs to be entered into the laboratory computer system. So the information that's taken out of the doctor's practice system, put onto a request form, then has to be re-entered into our computer system with our staff. We have a large number of orders, so that is quite a considerable time resource that's used there in getting that information into the system before testing can commence. It's vitally important that the information that is entered into the laboratory computer system is accurate. So we put a lot of effort into auditing that data. Every single request is audited immediately after the first entry, and that also takes a lot of resource. We aim to be 100% accurate with that. That's our a key goal for us, that and timely throughput. So with eLab, what that allows us to do is the information is extracted directly from the GP practice computer system, and it doesn't have to be rekeyed into our system. It can be electronically transferred as an electronic order. So once the patient presents to our collection room using barcode scanning, we can read all the information that's available electronically and capture it in our computer system, and that means a considerable saving in time. It means there is no error introduced through transferring data. Correct data travels straight through the system.
We've had approximately 25 GPs involved in our second pilot. They've come from 2 regions within the Greater Wellington district. We've even had some GPs who weren't involved contacting us saying, "Why didn't you pick me?" So there is obviously some enthusiasm for what the system might provide to them.
Once the specimens arrived in the laboratory, it was very simple barcode reading of the form, and immediately the data is available. So staff found that great to work with. It was very quick and snappy. With it being much quicker at the specimen reception area, we see faster throughput of the samples through the laboratory. We track the percentage of registrations that occur at certain times of the day. That's a benchmark that we routinely monitor, and during the pilot, where even a small number of samples were coming in as electronic orders, we were able to see a positive trend in the throughput times, that they improved. We had more samples registered by the usual benchmark times, and slightly earlier finishing times for the staff working through the day.
Aside from the efficiencies that are brought into the system using eLab, there are definite benefits to the laboratory and ultimately the clinician that mean we provide a better service and better clinical advice back to general practitioners. With more information available to us at the time of testing, we can then provide greater interpretive detail, which is incorporated into our pathology reports. There are some exciting opportunities provided by this technology. Lab-to-lab referrals, I think, is one important component of that. Currently, often when a sample is sent on to a second laboratory for testing, they face the same issues that we do as the initial testing laboratory, where we have to rekey data. The system has the potential to remove that step out of the process. Now that our pilot programs are completed, we want to embark on our full implementation. That will involve setting up a project team who then go out to practices and initiate full training actually within the practice. I think that training will be essential to getting good uptake from general practices. We're going to try and roll it out across the region in an organised way. We're going to start with the northern region which we service. That way we can train our staff at the same time as we train the general practices. We will then move across the Wellington region. So any of those who haven't been contacted by us yet will just have to be a little bit patient. eLab provides us with some very good opportunities, as well as the transfer of data at the time a request is generated. We have opportunity to provide the clinician with some up-to-date clinical information. So through accessing websites related to the tests they're ordering, they can download current guidelines and just implement current best practice.